Hello. So this is Bloomvault, Fatima's personal health record that summarizes her health uh, data that she'll be able to share across with different providers whenever she's seeking services. So when Fatima logs in, the first thing that she'll be able to see is a timeline, and this timeline is also on the left side. And what is included on this current iteration is we have a timeline of, since this is a maternal and child health journey, where there are so many immunizations and also antenatal care visits that usually do happen. So she has a timeline to ensure that her dates are well taken care of, her dates for the visits that she's supposed to attend, and the dates for vaccination for the children that she's supposed to take them in. So there's on the left side, we used a simple UI. On the left side, she has the summarized version of all the summaries that she can access directly. And then on this right side, we have the overview of the pages. Uh, Through here at the dashboard, you can also consult directly with healthcare providers, that is, her doctors, the nurses, or anyone else to request any services, or also to report anything that she's having a challenge with during her pregnancy and also motherhood. So when she consults from here directly, she'll have to get an option of booking an appointment, or she can chat with the healthcare provider. Also, when you look at the timeline here, so most of the information she'll be getting are assisting information her, so that she will know what's important to know during each week of her pregnancy. So a lot of information where she can consult on and also read on more information on how to take care of herself during pregnancy. And this does not only limit it to pregnancy, but also in during her children's growth and development, assuming there's a period of under 5 where children are most vulnerable. So they included in there in the timeline. So she will have different timelines for each and every of her children. Uh, Within the health summary, also, she has the opportunity to share her data, and this is any data that she wants to. She can share the whole data, or she can share them individually. So when she clicks share, then she'll get a QR code, a scanner for QR code, where she will scan the QR code. And this is based on the assumption that the CDR on the healthcare provider side is an open EHR uh, standardized CDR. So where then she can grant access, and it can be viewed in an openEHR format after scanning. So if she is not able to scan, there's also the ability to just request an OTP, so that we ensure that she's giving consent uh, to whoever is accessing her data. Uh, she'll also be able to see the immunizations that have been given for both her and her children. She can also see the vitals and track them for the same, making it easier for her. She can also see her problem list, and we've taken this problem list as the recent diagnosis that have been either confirmed or are in process of being confirmed. Uh, when you come to the medication summary, and here on the health summary, the data how we are storing this data is using majorly SNOMED codes, and that's it makes it even simpler when you are talking of sharing it across systems and solutions that are based on the openEHR conformers. So her medication summary, when she comes, she gets to see and view all her active medications. And this data is coming from RxNom. She gets to see the stopped medications, the same, even for her children. When you come to the history, she gets to see her own history and also the family history. And the results, she'll always get a report of the lab tests or imaging tests that had been done on her, a summary that she can share with other providers if need be, and different reports. So on the allergies, we divided this into medication, food, and others. Particularly for the medication allergies, then she would be able to share this in terms of emergency when she's supposed to receive emergency care. Uh, the advanced directives, also we have allowance for that to accommodate it, and also the procedures list, the ones that she's been scheduled for, the ones that she's undergone, and the ones that were recent and the outcomes that emanated from there. So this is not exhaustive completely, but we are thinking of adding other use cases that we've seen are important during transition of care or delivering emergency care services uh, at a go. So we are looking forward to continue working on this and hoping it's going to be a great project because it's something that we are looking forward uh, as it will enable transition of care and also a way to partially break down silos